It's a pleasure to have you here with us today. Thank you for taking time out of your busy schedules to take part in this. I believe this is going to be a very engaging and responsive sessions, considering what we've already received from you guys. In looking at the lobby poll, it appears that a lot of us already have a built-in affinity. While we're here looking at question is addressing coalition sustainability a priority in your community. More than 60% of you see it as a high priority or essential. And there's 28% that see it as a medium priority, which is extremely important because addressing sustainability is right at the center of the strategic prevention framework, which a lot of our work is informed by and what we use as a tool. How active were your coalitions in 2019? It's really stratified there. With the bulk of those reporting that in 2019, about 28% were just moderately active, which is about normal. We generally tend to shift between moderately active and to extremely active over time. It is just a little bit concerning. We'll explore it more during the day that only about 9% recorded that their coalitions were extremely active. So that is something that we want to pay attention to, and I would definitely like to explore more about that, and so that we can gain a better understanding of where we are when it comes to our coalitions. And on the last question, how active were your coalitions in 2021, which was last year, the year that just passed us, and about the same, only about 9% were extremely, and again, moderately and slightly were at the highest point. About more than 50% were moderately or slightly active. So there's something going on. It's something going on in our region. But the biggest thing to pull out of that is there was a huge transition or change that took place from 2019 to 2021. But overwhelmingly, it looks like your coalitions weren't dramatically affected. And I think a lot of that comes from the fact of the work that you guys do in prevention in order to ensure that there is sustainability. Okay, everyone had an opportunity to see those polls. That really helps me. This is our acknowledgement slide. I won't take your time by reading the whole thing. I am your facilitator. When I was a student at the University of Arkansas at Pine Bluff, UAPB, and it's here in Arkansas where I'm currently working, that was 1995. And me and a young lady named Tabitha started a group called the HIV/AIDS Peer Educators. Tabitha and I did not share the same ethnic background, which helped us recruit a diverse group of students. And we were both veterans, which gave us a common ground, a shared experience in life that fueled our ability to work together. That group of students we recruited became the HIV/AIDS Peer Educators. And to my knowledge, it is still in existence now at the University of Arkansas at Pine Bluff. The college was our community, and that club was our coalition. And we collaborated with a local community health center, which provided HIV screening. They connected us with the health department, which provided us education and built our capacity. We implemented testing on campus by hosting parties. And the way people got into our parties was taking a free HIV test. We evaluated our success by providing surveys at the health clinic, and we saw awareness rise on campus and new HIV cases decrease. The incentive for completing our survey was good quality condoms. And it was sustainable because a nurse on campus kept the chancellor informed of our progress and helped us to recruit more students every year. The health department kept us a big supply of condoms. This was not a job. This was not our job. We did not get money for this. It was successful because we were committed and we found a diverse group of students and staff and community members that also shared our vision of a better campus. I graduated from UAPB in 1999 with a degree in psychology. But sustainability worked then during a pandemic, and the principle of sustainability still works now during this pandemic. I hope I can help guide you today through a conversation in this affinity group that brings together people with similar backgrounds so you can influence your communities and coalitions to start exploring practical ways to sustain the efforts that you have been involved in for so long, so that you can continue to increase awareness about ATOD, alcohol, tobacco, and other drugs, and also decrease the misuse of substances. I'm Derek Newby, and I am your facilitator for today, and I want to guide you through this experience. Our learning objectives for today are to assess the best practices in sustainability that support inclusion for communities of color, to examine the challenges that are related to sustainability when building community coalitions, and to explore perspectives related to sustainability that support the development of an action plan. As we begin, and we go over our survey that I showed you and think about the answers that you provided, we have shared values. We have a shared focus. So we invite everyone to be active today and participate in this discussion, because we greatly value and respect different perspectives. And together, we can protect potentially confidential information as well by essentially keeping what is said here within this realm. You are welcome to invite others to join this affinity group, because this is just not a one-time thing. This is a series. This is the first of our 3. And I would hope that you would look to your peers and colleagues, coalition members that are in your community, and share this information with them so that they can too join and be a part of the solution. I want to learn a little bit about you guys before we begin. So this is your time for introductions. I welcome you to use the chat. And as you put your information in the chat, I want you to put a 1 by it, a 2, a 3, a 4, or a 5, depending on which of these images currently represents how you feel about the status of community coalitions in your state. Chose 1 to give a brief explanation of why they chose 1. So if you chose 1, please open your mic and tell us why you chose 1. Explain why.
Okay, I chose 1. From what I can see from my computer, it looks kind of empty.
Yes.
And due to a lot of the COVID restrictions, I've been unable to really get into the schools or any of the coalitions the way I want to. So just for right now, I chose 1 because that's what it feels like.
Thank you for sharing, Jennifer. I appreciate it. And is it okay? I know Jennifer, that's why I called her Jennifer.
Oh, that's fine.
Okay. Someone who chose 2 now. One person who chose 2. You could please open your mic.
I chose to because it looks from down here in Texarkana, we're having meetings, but we're not getting any further out. We're not really doing a whole lot in the community. We're just coming together to discuss what might need to be done, but nothing else is happening.
Interesting perspective. Thank you for sharing, Rachel. Williams. And someone who chose 3. Someone who chose 3.
I chose 3. I chose 3 because I'm actually from Massachusetts and I work primarily with youth. While our adult coalition is not meeting in person yet, the youth are back in schools and they really want to be meeting in person, not on Zoom anymore. And doing that safely. But yeah.
Thank you, Karen Mullins. I appreciate it. And someone who chose 4. Who shall share with me who chose 4? We'll share with all of us.
This time, every day.
One person who chose 4. Okay, someone who chose 5 then. We'll move on to 5.
Hi, this is Cynthia Montini. I was going to speak on behalf of 5.
Okay.
I chose 5 because currently in my position with the school lockdowns, with the small community that I live in, and with all the job openings, it does feel overwhelming because each of us is balancing about 3 or 4 balls in the air, just trying to get through our days and trying to come up with different methods to get out to our community and COVID is really throwing us back quite a bit. So it seems like for every 2 steps we take forward, we take 3 back.
Excellent. Thank you for sharing. All of these represent a perspective. Our feelings are valid. I think at any point in time, any of us have felt like our coalitions have been at one of these stages. One being that empty stage when you feel like just nothing is going on and no coalition activity is taking place. But you're providing everything that you have to provide, all the resources, even the place to meet, and they're just not showing up. To what we seen the transition take place at number 2, where people started meeting on Zoom and they started using technology in order to start coming back together. And then 3, where small groups of people, or even your whole coalition may have decided they were going to get back together. There was a point in time in these last 2 years when we did feel like it was okay. And people started to come back together again and they started to meet and they started to catch up on activities that may have fallen behind. To all out at number 4, where you have communities that, especially with the youth, they decided that they wanted to get together and they wanted to get back upon the duties that were at hand in the work for the coalition. And they found a way in order to make it happen. In fact, it wasn't too long ago over this summer camps were meeting again. If anybody can remember that time, people were getting back together again over this summer. 4th of July, people were told that it was okay to gather as families again. To number 5, where there's that overwhelming feeling that there's so much to do and there's just not enough people to get it done. As you transform through these stages and you see your coalitions transform through the stages, you want to be able to provide support to them. You want to have a sustainability plan that's being looked at on a regular basis so that as things change, your sustainability plan can change as well. And that may look like different things in different communities. In some communities, it may be revising your overall state plan. In some communities, it may just be your coalition members deciding what they're going to do differently. It may mean that the state has to revise their whole system at some point in order to make it work for the community because things have changed. But regardless, in any plan that we create or our coalitions create, it must have sustainability at the center in order for it to be successful. Sustainability is that process. It's that process of building an adaptive and effective system for long-term results. One of the ways that that is done is by building ownership among the stakeholders. And that's something that we can't wait to do until things go bad. That's something that has to be built in along the way. So when things do occur and there's a pivot that has to be made, they're already ready to make that change. Sort of like how they have fire drills at a school. We don't wait till there's a fire in order to teach the kids how to evacuate. That's something that's practiced on a regular basis, and there's a plan in place. Some organizations, some coalitions had a plan, some didn't. But overall, we were all caught by surprise at how extreme the change that took place from 2019 to 2020 was. But in building ownership among stakeholders, it takes collaboration. You have to build in and develop those memorandums of understanding. You have to compile and develop culturally appropriate information to distribute at community events and address barriers ahead of time. And one of the important things, like when I talk about what happened at UAPB in my own situation, is that we shared results. That was a part of our sustainability plan because the chancellor knew what we were doing. It was something he could regularly communicate to the parties that were interested. So it helped us to maintain our program over time. So what have you done to demonstrate the results? Sometimes you have to go back and dig out those results that have happened in the past to revitalize the coalition efforts. How have you documented outcomes over time? Because document service usage before and after social marketing campaigns is one area that we've seen has transformed significantly over this past 2 years. Prior to that, if we did something on social media, it was just something that was out there and we really didn't bother tracking it. But I think many of you can agree that social media became extremely important over these last 2 years. Is there anyone who wants to add to that conversation about social media? How has it found itself incorporated into your plans or into your coalition efforts? You can chat or you can open the microphone and talk. So in identifying those program champions, that's something we're going to talk about later today, because one of the things of having a good sustainability effort within a community is empowering the community. And program champions help to empower the community. They really fuel the prevention efforts because they're respected leaders within the community, and they're the ones that carry your message that support the change. You ask yourself then, well, how much have we invested in capacity building? Capacity building means those skills of those coalition members. Coalition members cannot be assumed to effectively search for education and to build their own capacity. That's something that as preventionists, we have to be active in doing. And even if the funding ceases, there should be a sustainability plan that continues to invest within those coalition members in their growth so that we continue on and they have a sustainable effort in the future. As you identify diverse resources, employ you can continue to use those resources and share those with your coalition members so you empower them. We often have access to information that coalition members don't have. And the more we share that with them, the more we empower them. And teaching them how to analyze the systems that they're working with, it moves to a point where you're not the one doing the asset mapping, but that coalition is doing the asset mapping within their community. And we're going to talk about that a little later, because that is one of the tools that helps to strengthen the alliances that can sustain any prevention effort. Because asset mapping lets you know on a continual basis what's available within your community and what resources can be utilized. SAMHSA has tools that are available for you so that you can continue to grow in this area and become more familiar with these things. And it's on www.samhsa.gov. I also have it in the reference page, so you'll have access to that. But it's called the Strategic Prevention Framework Guide. And when using that guide, it'll walk you through step by step on the sustainability systems, what is in place, and how to empower those who are working in prevention to utilize them. Sustainability has to be at every level, though. So from the beginning of building relationships with your stakeholders to the end and reporting back to systems so that you can maintain funding within a community, there has to be a sustainability effort that's built in at each stage. Are there any questions? Or would anyone like to add to this? I see some things in chat. I'm gonna check the chat. Okay, thank you, Wanda, for sharing that there. Okay. Social media has been extremely helpful in connecting with community members the last 2 years, especially with youth. Instagram Lives are helpful with getting information out. Excellent. Thank you for sharing that. If there's anybody here has not utilized that as a resource, please take note of that, because that's can definitely be helpful for you in the future. It's a way of like instantly empowering youth to be able to put out information themselves, like especially as a youth coalition, in a way that their peers are going to receive it. And it takes very little effort on the part of any adults that are working with them. It can be purely driven by the efforts of the youth who are involved. Anyone else has anything they'd like to share before we move on to the next slide? Okay, so one thing that I talked about early on and reminded everyone is about diversity when it comes to your coalitions. And that's one area that you may have lost some ground in. But the question out there is, why engage Black, Indigenous, and people of color communities? Please open your mic and share. I want to get everyone's response to that, or as many people as we have time for. Why? Why do we engage Black, Indigenous, and people of color communities?
Mr. Newby, I'll go. This is Dr. Golden from the University of Arkansas at Pine Bluff.
Wonderful.
Okay. So why would we engage different groups, cultural groups in our community coalitions? The main reason is because we do not live in a bubble in our communities. In many communities, you might see people interacting on certain parts of town, but when we look at the overall aspect that we're having on communities, everybody should be able to chime in and talk about, because the more information we know about the different groups, the better we will be able to put programs and services together in order to serve our entire community.
Excellent point, Dr. Golden. Thank you for sharing that. Someone please like to contribute? Why engage Black, Indigenous, and people of color communities? I think we have a
Yes.
yes. Mr. Haley?
I think we need everyone's perspective, and you know, the attitude of each culture, no matter what it is or what color. We need those perspectives.
Okay, thank you. So what are the benefits of a diverse coalition? Many of you come from different communities, so the mic is open. Please share.
Get multiple perspectives, multiple solutions.
To get multiple solutions.
The coalition should reflect the community it serves, and if the community is diverse, then including those, and would mean that it would reach more people.
Excellent. Thank you, Ms. Hall. What are the benefits of a diverse coalition? I mean, if the coalition is simply to get to work and to transform the communities, why is it important? What are the benefits of having a diverse coalition?
Can you guys hear me?
Yes.
Okay, I'm Joshua Bonet. I'm a prevention specialist in Amarillo, Texas. Just the benefits of being able to have a diverse coalition is really being able to hear and share the different experiences from that go from different culture to culture, you know, because every culture has different experiences, different values, different ways of life, and being able to have an understanding, have knowledge of that is important when trying to build a community.
Wow. Couldn't have been said better. Thank you. Next. Trying to list these benefits.
Hi, Derek. This is LaShonda Williamson Jennings from Northern Oklahoma. I think that one of the benefits of a diverse coalition is to address health disparities. So one of the things that we do is we certainly know that health disparities exist and are baked into the systems within the communities that we serve. But one of our jobs as prevention is to prevent a furthering of those disparities. And so if we don't have certain people at the table, then we simply perpetuate an issue of ill health within this BIPOC community.
Thank you, ma'am. So, you know, health disparities refers to the difference in adverse health conditions that exist in certain populations. So even though it may appear your community may be doing well, it also depends on what part of your community that you're looking at. So researchers have found that health inequities exist and persist throughout the continuum of care. Therefore, if your communities have been impacted by an adverse health event, which all of your communities have been now, it's logical to believe that minorities or BIPOC communities have been impacted at a greater rate in your communities. So when you consider that BIPOC communities have been impacted at a higher rate, it's important then to start reaching out to those community members and finding out what help they need. It's important to engage those populations to check in and help bring them back to the prevention table. So what are some of the obstacles that one may face in an attempt to accomplish this goal? As you reach out and you try to bring people from diverse communities back to the table, what are some of the obstacles that they either are facing or that you may face as a preventionist in bringing them back to the table? Please open your mic to answer.
You may receive pushback from certain groups that might not want to include others. Also, I would think that there could be communication issues with or different perspectives kind of conflicting and trying to effectively communicate across all those barriers would be a challenge. Doable, but a challenge maybe.
That's right. Thank you, Ms. Hall. What about discrimination? Historically, that's one of the challenges and one of the obstacles. If you have a community that only has 2% Hispanic and 2% Black, like many communities here are in Arkansas, and you have like 96% white, what do those coalitions mostly look like then? Do they reflect the community, or do they generally look like just one group of people within the community?
I agree. I think that's a great point. Representation, in my opinion, in order to bring perspectives from different communities, it's good that you make sure that you see to it that representation from each group is present, and that you receive, in my opinion, a good amount of perspective and reaction. So that way you'll get closer to, how should I say, finding a solution instead of moving, I guess, away from the solution.
Excellent
So, yes,
point. What about access to the meetings and transportation? Would that be an obstacle? How many people in your community, you can raise your hand if you don't want to open your mic, do you believe have faced that obstacle when trying to gain access to meetings and transportations, where they wanted to be a part of it, they wanted to be a part of the change within their community, but they just didn't have the ways and means to get there?
One of the things that I've noticed is along with transportation, also just the access to the information, where the meetings are, what time they are. A lot of people miss out because they feel like they're excluded from the information.
Excellent point. Thank you, Ms. Hall.
There is a community that hasn't been mentioned, and it's no respecter of color, gender, or a location, and that would be the homeless community. And I believe that these folks not only have transportation issues, they have the disadvantage of not being able to the information they need just to help us, and the retention of this community.
Thank you so much for sharing that. That's correct. Everybody in our community is important. And a lot of times they call those like the invisible populations within the community. And people don't necessarily take consideration to even invite them to the table. But everyone that's homeless doesn't mean they necessarily have a problem. Sometimes people have just selected that as their way of life. It's not for us or for the community or the coalition to decide that certain groups of people don't matter. And you're right, that information has to be widely available, and it has to be accessible to people, and they have to feel invited to come to the table so that they can, again, help shape their communities as well. Thank you for sharing that. Other obstacles, what about work hours? What do you think about that? Work hours being an obstacle. What are some obstacles from your community that you know that people are facing?
Hi, this is
Um,
Cynthia in New Mexico. And one of the obstacles we face here in northern New Mexico is honestly just ego. Trying to get all of our other groups to work together and not feel this sense of competition of who's leading what, instead of all being collaborative and working together. I find that that's been one of my major problems, and that problem will lead to the scheduling problems.
Wow. Thank you for sharing.
I would say also childcare.
Childcare.
If you're involving mothers, they may have a problem finding someone to take care of the children while they meet.
Excellent. I'm glad we're getting all these on the table now, because we're going to be talking about, that's one of the reasons why we're coming together in this group, because we're going to be talking about solutions. There are some communities that have found solutions to some of these challenges and some of these obstacles. And by being here together, we can share those with each other so that we can all overcome them together. Are there any other maybe unique obstacles that you've encountered when trying to
Hello, I'm Commander Luz Rivera, and I would like to add the Afro-Latino community, because when people see them as part of the Black community, but they're Latino and Hispanic, and they have a different culture and a different language. So it's a barrier for them, and they feel like they're invisible, and they don't know which group should they go to.
Wow. Thank you for sharing that. Please take notes. Next, let's put it all on the table. What are the obstacles?
I would have to say homebound and in the elderly, because they are isolated and they don't have the opportunity to get the information. I would have to say those that are isolated for whatever reason needs to be included somehow, some way, so that they are able to get the information they need for their purpose.
I think we all experienced a little bit of this in the last 2 years just on our own. So we have a better understanding of what it feels like to be isolated now and to think about, some people they live like that on a continuous basis. We have people here, and I keep pointing to Arkansas because that's where I've spent the last 20 years, who have never even left their neighborhood. And some people, like in rural communities, that still don't even have access to the internet, but we assume that they have access to information. They don't. It's a regular newspaper that they may get their information from, or they get it from word of mouth. There are a lot of communities that don't have access to the internet right here in Arkansas.
One of the things, this is Cheryl Navarrete, also from New Mexico, and Cynthia actually is my project coordinator for one of the prevention initiatives that we have in the northern part of the state. And what I've come to realize in trying to deal with coalitions is that maybe in the beginning, like back in 2016, when the Northern New Mexico implementation team at that time was somewhat valid and somewhat doing things, and that's when Project RAISE came about. Since that time, the structure has dissipated. There's no structure, there's no goals, there's no anything. And it's gotten to the point now where we don't have a leader, and because of job situations, like with Cynthia being the project coordinator right now, she's shorthanded. Her hands are tied trying to teach kids at school and do 50 million things at one time.
Wow.
I'm a multi-hat person within the HIDA program itself. I do training, prevention, I do inventory. And so I can't become that leader either. And so trying to find a leader that we can get into place to establish the structure or reestablish the structure, if you will, for the coalition and get the coalition back up and moving forward has been a really big problem for us.
Thank you for sharing that. That's one of the major reasons of why we're here today, because we know that coalitions have been severely impacted, but we don't know to what degree. To everyone, when you even when you looked at the first survey that we sent out, and we asked the question, what's one thing that's contributed to your coalition success? And there were some people that reported that, there was nothing. They were just still trying to build coalitions. And one said that we're a brand new coalition in a county, and our first meeting will be January 18th, 2022. So there are others in this group who are experiencing similar situations, and we're going to work together in order to build everyone up. I'm sure many of you have heard the proverb where like one stick by itself is easy to break, but a whole bunch of sticks, when you put them together, unbreakable. And we're going to come together and we're going to find a way to support each other. Some of the tools that can help you are available on the PTTC website. It's called Community Engagement Resources. And, we're going to post that link for you in the chat. Let me see if it's posted yet. Okay. There we go. It's there. Please use this resource. It'll give you an in-depth look at a lot of different tools that can help you guide. These are resources for you for re-engagement for your community. And as you utilize these, go through these tools, they're very diverse. So take your time, find that's something that specifically works for your community. You can be that specific. And also share it with coalition members as well. As we come up with these obstacles, I say that and share this with you so you know that we're aware of some of the obstacles and there are solutions that are available. We want people to start accessing those solutions as soon as possible. And also, we have many other tools that are available as well, but this is one that I thought very relevant to share with everyone today. And the link is there, so please click on the link and also save it so that you can go back to it at another time as well, so we can continue. But I want to make sure you have that now. Is there anyone else who wanted to share an obstacle before we continue to move forward? Okay. So we understand that sustainability is a challenge. There are challenges to sustainability. But what are they specifically within your community? What are the challenges to sustainability within your community? Again, this is an open discussion. Please feel free to share. You can open your mic or you can put it in the chat. But what are some of the challenges to sustainability within your communities that you've faced already?
Hello, everyone. My name is Tiffany McAdoo, and I am in Central Texas. I'd like to say that one of the challenges when it relates to sustainability that I see with some of our community organizations and coalitions is just the fear of the unknown, seeking outside funding or seeking other partnerships that would also potentially leverage resources. And so they become so just accustomed to receiving certain funds that they just rely on those heavily. So when they go away, they end up scrambling at the last minute.
Excellent point, Ms. McAdoo. A lot of times, like when we talk about resources, they can be a double-edged sword. A lot of times communities need resources, but then later they find out that some coalition members only came to the table because those resources were there. And later they may leave and not be active once those resources are there. So that is definitely a challenge that we have to face and we have to take into consideration at all times. So how do you navigate that specific challenge? Does anyone face that same challenge, and how did they navigate it? Come on, I know someone has faced that challenge before.
No, HIDA, because it's a grant funded program, can only offer so much money to our prevention initiatives. And Cynthia has tried to review and find other areas that she can get funding in or from, so that we can be able to boost that initiative up there in Espanola area. And I think she has a couple of funding initiatives that she's looked at, and grants anyway. And as I advised her the other day, because I'm going up next week, and I told her, I said, while we're there, we'll sit down and we'll look at it, because she doesn't have all the time in the world to be able to do the grant process, but maybe it's something I can help her with. So trying to get people to come together to do a joint project is probably something else that really needs to be looked at, and try to come up with a way where you can get people involved, even if it's just a handful of people, to be able to help you to do a grant.
Excellent. And that's when you say that, it triggers a memory in my head. When we're trying to help organizations grow within a city that I lived in Pine Bluff, we realized that was a need we had. We had a grant. We needed a grant writer. We couldn't afford a grant writer, but we could build relationships with organizations who had grant writers. And as we built those relationships, they were willing to share their resources and even share their people with us, because they wanted to help us grow as well. That partnership led to growth of both organizations. And that's something that you can look for as you're trying to help your coalitions as well. If some other agency or organization has something that you need, it's important to work with them and let them know what you have to offer, so that they're also willing to share their resources as well with you, and we can both grow together. Anyone in any other sustainability challenges?
Hi, this is Cynthia, and I work with Cheryl. And just to go over that point a bit more, that is definitely one of the biggest challenges, is to try and get us all to share those resources. Yes. And opening up to the idea of different, of what we're offering in a different way. We've kind of stuck to the traditional model for the most part, and then we've come up with some new ideas to try to make us a little more successful and try to really expand out into the community and really pick up the community interest. But one of the obstacles that we've had is, number one, funding. It seems to be a universal problem. And number two, just opening up to the idea of something new, something different, taking it in a different direction, taking risk and trying new things. Here in northern New Mexico, it's very much this is how we've always done it kind of attitude. So when you
seen
come
that
in,
before.
yes. And when you come in, that makes it really difficult. But what we have tried to do is to form this huge coalition of everyone that's offering services, so that we can all support one another and then have one community resource list. So if we walk into any one of our offices, if we can't offer what the person needs, then we have a list of everyone else and what they're offering. So we can always do an actual handoff, something personalized, as opposed to just saying, here, try calling this number.
There we go. That is a pearl. Thank you for sharing that with us. Another, yes.
Yes, I'm just new into this field, but I think another thing is, keeping the interest. People get excited about a project, but then, the interest begins to dwindle. And, just keeping that fervor going is very important.
Thank you for sharing. Some other suggestions that I want to share with you is finding people who are connected to the problem. When you implement prevention programs that target populations experiencing behavioral health disparities, it's important to find the people who are connected to the problem, because they have the biggest stake in making sure that there's a sustained community change. If you have a parent or a school teacher that's vested in the health and welfare of the children, they're not in it for a one-time thing. They want to see an overall improvement within the health of the youth that they work with. They want a sustained effort where youth are experiencing less and less with alcohol, tobacco, and other drugs, and are vested in being drug-free. So when you find those people who are affected and connected to the problem, then it's very easy to form a sustainable effort, because that person will be willing to stick there, whether or not there's resources there or not, because they're vested. Another suggestion, when one of the problems with meetings is holding a meeting at times convenient for all the participants. And that may mean polling the participants. That may mean non-traditional hours. That may be holding a meeting at a place where it's accessible to everyone. When I was going to study and become certified in prevention, one of the questions that kind of like caught my attention was the one about holding meetings and accessibility. Because the first thing you think about in accessibility generally is like, well, it's at a building and it's indoors, and so it's a public building, anybody can come to it. But that's not necessarily always true. I had 4 aunts that were in wheelchairs, and they couldn't even go to high school for a period of time before the governor interceded and made sure there was changes that took place at the local high school so that they could just attend school. And that was a public school. Think about a meeting space. When we have meeting spaces and we secure meeting spaces, are we taking into consideration everyone in the community and making sure that they have access to that meeting? And then sometimes it does take incentives. Even the efforts that I worked with was on the campus of a University of Arkansas at Pine Bluff. In order to get the youth involved, we had to have some type of incentives. Yet we used free condoms for that effort, but you have to find out what incentives the people that you want involved need in order to have access to your meeting. It may mean free bus passes so that they can take the bus there. It may be forming a ride share group where if they need to come to the meeting, then they have people within the community they can call that are involved in the meeting as well, that'll bring them to the meeting. So you have to consider incentives, but you do it by talking with the people. You involve the members of the groups in the design and the delivery so that you have a better understanding what the people may choose so that they can participate in different ways. Because that may also mean that some people have different learning styles. And if all we're doing is having Zoom meetings, but I have no understanding of how to utilize a computer, then is that meeting really accessible to me? So you adapt and you tailor your meetings, just like we adapt and tailor evidence-based practices and programs within the community so that they can be culturally relevant. That may be having an in-person meeting, that may be having a Zoom meeting, that may be having a letter meeting where all the information is written in a letter and mailed out to the participants, and they can vote by mail what their preference is on the activity that the coalition is going to proceed with. And giving them ways to participate other than traditional ways. So the original design of having a meeting in a room with everyone sitting around a table, that may be a thing of the past. I don't know how long this situation that we're in is going to last, but it's time to look past what we've done and start looking to what is possible for our future. Virtual is the thing now, but it may not be the thing for your community and for your coalition members. So it has to be discussed with the audience before that decision like that can be made. And you have to find out the best way that you can help them to move forward with their plans. Because ultimately, when we talk about leaders in the community and finding the stakeholders and finding your superstar within the community, they need to be at the table and helping to make the decisions on how the coalitions are going to proceed. And you have to light that fire back under them because of the fact that there's been such a dramatic change and people may have been affected by that trauma as well. So it's a lot on your tables. So what is your perspective? I'm going to do a brief survey right now with you. It's only, I think, 10 questions, but I want you to answer them honestly because they're going to guide the rest of our talk for today. So, and they're all about what your perspective is, because your perspective is a way you think about or understand something. And everyone here has shared their perspective prior, but this is going to get a little more in depth. So if we could please start the poll now. Remember, this is your perspective. There are no right answers, there are no wrong answers. It's your perspective. Do your coalitions use population-based definitions of community? Do they let the community define itself?
I just want to remind everybody there is 10 questions. If you just scroll down, you'll find the rest of the questions on the list.
So does your coalition value the importance of relevant, culturally appropriate approaches? And again, remember, there are no wrong answers. Your perspective is how you regard it. Does your coalition support the development of culturally specific services? Does your coalition support the development of culturally specific services? Does your coalition include culturally relevant outcomes and indicators in the evaluation approaches? culturally relevant outcomes. Does your coalition update their sustainability plan when conditions change? Do your coalitions consider access to meetings before they change the way they meet? Did your coalition members reflect the community it serves in 2019? And do your coalitions currently reflect the communities they serve? When you look at your coalitions, do they look like the community? Because there can truly be nothing for us without us. Everyone has to be included. And have you considered recent events in planning your capacity building efforts for your coalitions? Looks like most, if not all of the people have answered. And just starting backwards, have you considered recent events in planning for your capacity? It is excellent to see that 79% of you have answered yes to that, because that is an important aspect. You have to consider what your community needs in order to build their capacity. And that may come in different shapes or forms. If anyone wants to share like how you've considered your recent events in planning your capacity building efforts for your coalition, please open your mic and answer now. Okay. Anyone like to expand on what their answer was for any of the specific questions? You may have something unique that you want to share, and I want to give you a voice. Anyone like to share their perspective? I am waiting.
I would say with the specific coalition that I'm involved in, there's been a lack of consistency there with as far as just meeting and just staying on top of the things that we're trying to tackle in the community. You know, because we'll have a meeting every once in a while, we'll talk about it, we'll have a good discussion, and then there's not a whole lot of follow-up from there. So I think there just needs to be more consistency going forward as far as the coalition and what we're trying to tackle in the community.
Thank you for sharing. So these last 2 years have been more than any of us could have ever anticipated. And many of our coalition members have had traumatic experiences that shifted their perception of the danger of alcohol, tobacco, and other drugs. And I want you to take that into consideration as you go back into the community to work with them, because your attitude matters right now as you engage your coalitions, because attitude can influence perspective. And I know some of you are tired. I know some of you may be frustrated as well, because it seems like, well, they just don't want to meet, or they don't want to sustain the efforts that they had before. And it feels like I'm having to push harder and harder to get them to do the same things they did in the past. But your attitude matters as you re-engage your coalition, as you try to educate them about, or re-educate them about the danger of alcohol, tobacco, and other drugs, because that has not changed. It is still dangerous. So when it comes to sustainability, it is still important, and we must encourage coalitions to work for it by developing or updating their plans. Diversity matters, and we must help bring it back to the forefront. And inclusiveness is an ongoing conversation that can't be forgotten. So it must be reevaluated at this time. See, perception of harm may have changed, but it's up to us to help refocus the perception of the coalitions and their perspective. Involving stakeholders who represent targeted sectors is associated with more impactful planning. So we have to re-engage those stakeholders. In some cases, we have to go out there and we have to find them to get them re-engaged, so they can be a part of the implementation of the prevention strategies that you are proposing to the community. Ultimately, it's their choice on what they decide to do. But I ask you, who are your stakeholders that are still there in the wake of what has happened in the last 2 years, and how many may have been lost or moved on or even left your community? You have to refocus and find those stakeholders, and understanding that they may have been impacted as well. So there's a certain amount of trauma that we are all sharing within all of our communities. Opportunities for members to take on significant roles has been shown to create and contribute to the development of empowering environments, as well as increase the program's success. So what opportunities do you plan to create this year for your coalition members? The results that I shared with you, the answers that you provided, they're all anonymous, but you saw the numbers. And if you don't know the answer to some of those questions and you had to put unsure, then it's time to go find out. And anything that you saw there where you see needs additional work, then it's time to go and do the work. Your perspective on sustainability and diversity and inclusiveness is going to shape how you traverse this new environment. So, as you do, I also remind you, don't assume. It is time now to reassess the community. If you're not sure, then just like we did a poll here with you, then it's time for you to start assessing and polling your community as well. It's time to re-engage those coalitions. Let's talk about, as we get ready to close, what are some of the ways that you can connect with your coalitions? Just thinking in your mind right now, what are some ways that you can reconnect and reassess your community? You can put it in the chat, or you can open your mic and talk. And if you have a really innovative way, please share it. Is it fair to start calling names now because we're getting to the end and we feel like we know each other? Or does someone want to open their mic and talk? Let's hear from somebody new. What are some ways to re-engage your communities and your coalitions?
I think one way we could simply do that is to send an email or letter to the former sector members or maybe the heads of those community-based organizations, or phone call to just see how people are doing, how that they have landed, show some concern and care, and then invite them to come back to your next meeting. Maybe do a phone check-in and then an email to the respective organizations to ask, if they can't attend the meeting, can they send a representative, and maybe find out what has been going on with that sector member or their agency or organization over the past year. That would be my recommendation.
That's a wonderful recommendation, Ms. Mullen. Thank you for sharing. Someone else.
Hi, this is Cynthia again. I just want to say, right since COVID started and we've all been on lockdown, I think, and maybe I hope I'm not the only one, but there's been some difficulty in actually follow through. We make a phone call or we make an email and maybe a week goes by that we don't get a response. So my recommendation is we've got to be the squeaky wheel. If we really want these groups to come together, someone has to take the initiative and someone has to be the squeaky wheel that's going to make sure to stay on everybody, make sure that they do get responses within a specific time frame, someone who's willing to basically annoy everyone. That's what I think.
Couldn't have been said better. You have to essentially become have the spirit of the telemarketer.
Yes, exactly.
One other thing we talked about is, set up those key informant meetings. If you know who the key informants are, and those are the leaders in the community that can help bring people together, let's get them together first. Let's organize them. Let's talk with them. And let's have an effort, a cohesive effort to re-engage the community. We've seen some really strange things happen in my state. I don't know if it happened in yours, but we had made so much progress with social hosting laws related to alcohol, with alcohol access for minors. We had spot checks that were going on at all the different liquor stores to make sure youth weren't having access to alcohol. And then COVID hit and they started delivering alcohol to the house. Did anyone else see that in their states? And that significantly decreased I'm not going to say the fear associated with it, but the sustained effort that we had put forth, that people were well informed of the dangers of alcohol. Then suddenly it became an essential service. Did this happen in any other states? You can open your mic and share, or you can put it in your mic, or simply put a hand up in for your hand.
It happened in Maryland.
In Maryland too, okay. What about Louisiana? Is anyone here from Louisiana or New Mexico, Texas, Oklahoma?
I think it was true in North Carolina.
North Carolina as well.
I know in Texas, it was available via curbside, get alcohol to go.
Right. So there's a big effort that needs to start in some states in order to try and reverse some of these things. But I know especially here in our state, the preventionists that are out there working, it decreased like even the understanding of the dangers of alcohol when you classify it as an essential service. And it's about revitalizing the community now in those coalitions to change that perspective back to where it was. We need a perception of harm. Our perception of harm needs to be elevated once again, so everyone understands the dangers of alcohol. So it's going to take some.
Can you hear me?
Yes.
Yeah, I totally agree. I'm in Arkansas also. And I guess when I first heard about, alcohol deliveries, like you said, it reduces the importance of the work that we do, but also the dangers. And I was just, thinking about, really where would the liability lie if alcohol is being delivered to someone, and ultimately something, they went out and something, happened to them, because at the clubs and restaurants and places, the agencies, those establishments can be held liable if they're serving alcohol to someone that's intoxicated. They leave their event or whatever, and something happens. So, with this, could, those entities yet be held liable for that type of danger? That would be something that, the state's probably not even, thought about, are those that are, in the field are delivering the alcohol substances. Would it be the deliverer? Would it be nobody? Would it be the person, the establishment that sold the alcohol?
Excellent point. And these are questions to take to your coalition so that they can start addressing them within their community. These things, these issues that you have identified and the issues that you identify with them in key informant meetings, the things that are affecting their communities are the things that can help revitalize those coalitions and let them know that your efforts are needed once again. It's time to get back to work because so much has happened. There are 6 elements that support an effective coalition, and that's goal directiveness, efficiency, opportunities for participation, cohesion, diverse stakeholders, and new skills. These 6 elements work together to support a coalition's capacity to achieve desired outcomes in the community, including changes in community members' attitudes, the knowledge and skills, and community policies. And there's work that has to be done in all of those areas right now. The work that you do, the work that your coalitions do, will affect how resources are allocated. It will build relationships. It will set the new community norms and values. And collectively, these outcomes can be characterized as system transformation. So keep in mind as you go back and you work with your coalitions that you're informing them and waking them up so that you once again can get back to the work of system transformation. It's time for our next steps. There's gonna be a link to a Google form that's gonna be placed in the chat. And I need all of you to go to that Google form. If you have 2 screens, then you can have it up while we're on here. But at the very least, I want you to access it now so you have it and you can start completing it. I would hope that everyone will be able to get it to me by the end of the day. Some people are going to need more time to complete it, but since it's a shared Google form, no matter what time you complete it, I'll be able to see that you have completed the form, and I can send reminders to those who don't necessarily complete it, but I need your feedback. And the questions on that Google form are, what do you plan to do next? Considering that you participated today, you listened to me and your peers as well. And how will it improve the current status? How do you see your plans and what you plan to do next in improving the current status? And what type of support will you need to succeed? It's important that we know as a PTTC what support that you need so that we can help and develop tools that can help you. And last question, and very definitely not least, what specific questions, topics, and challenges would you like to address in session 2? I hope each and every one of you will return for session 2. So I want to see that everyone know how to use the, where is it at? To raise your hand, is it reactions? Yes. In your reactions, when you've successfully navigated to that Google form, if you could come back here and raise your hand so I know that you have access to that form and that you intend to complete it before the end of the day and send it back to me. Okay, I see hands going. Yes, thank you. Okay. See more hands. Okay. All right. Well, these are your references for today. The material that I shared with you and things that the tools that I think that you need to access to, the prevention framework guide that I refer to. Here's the link to it and the information where to find it, and the health equity considerations and racial ethnic minority groups, which is updated November 30th, 2021, is also available. I want to thank each and every one of you for being here today.